So good morning, everyone, and a warm welcome to this first HY talk of the year. I've been looking forward to today's talk where we will take a dive into the world of artificial intelligence, or AI as we call it. And I believe in an international context, this is a relatively new but also complicated topic. We are therefore fortunate to be in the company of Dr. Kristina Wallengren, who is the founder and the CEO of the health organization Think. Kristina will share some of the work they have been doing with using AI and help us understand some of the prospects and challenges associated with AI solutions. So Kristina, thank you very much for helping us out with this. The format of today's session is the same as usual. We will start with a 20 to 25-minute presentation from Kristina, followed by 15 minutes of questions from you. For questions, please raise your digital hand or post your questions in the chat. I should also say that we are recording the session, which will be available for streaming on our website at a later stage. That is it from my side, so I'll hand over the screen to you, Kristina. Please go ahead. Oh, you're muted.
Thank you, and I'm going to try to find that screen again that I needed to share. There we go.
Yes.
Do you have it? Well, thank you so much for inviting me to talk about AI and AI solutions for health in Africa. My ambition is that you walk away with an awe for how AI can revolutionize healthcare in Africa. And I also want to share some insights in how we are working with AI or the large language models like ChatGPT in our own organization, and maybe also inspire some of you to try it out in your work. So yes, I'm the founder and global CEO of Think, but I'm also a scientist and epidemiologist. And I've lived and worked in South Africa for about 17 years and only moved to Denmark last year as we opened our international office here in Copenhagen. So Think started as a clinical research organization, focusing on making a difference in the lives of those affected by TB and HIV. Sorry, I'm just trying to find the slide. There we go.
Oh, now your show disappeared from the screen.
Oh, did it?
Yeah.
Okay, sorry. Let me find my meeting again.
Yes, we can see it again.
You can see it again. Okay, cool, because I can't. Okay, but maybe I can do it now at the moment. Okay, there we go. Okay, so while we started as a clinical research organization, and part of our work was on developing better treatments for TB and HIV, and doing clinical trials and clinical research to improve and get new drugs and new treatment for TB and HIV. But in addition to clinical research, we have also done a lot of health system strengthening, which has been funded by organizations such as Global Fund or USAID. And this is where I want to start sharing some of the information or some of our experiences and using AI. And can you
put
now
it in
see
presentation mode? Because we just
okay,
have
there. Okay, so that's why it's not working for me. Apologies.
No worries. There, that's better.
Okay, is it still in presentation mode?
Now it's disappeared again. I don't know what is happening.
Okay, sorry. Okay, now you have it.
We don't have it.
No, you don't have it. Okay. Let me try again. Okay, now you have it.
Yeah.
Okay. Let me see if I can get through this now. So I want to share with you how AI is transforming health, and I want to give you 3 examples. One is through using AI and digital devices. The other one is how AI is helping us synthesize information. And the third one is how AI is helping us translate data. And in order to talk more about this, I'm going to use my topic of expertise as the example, and take you into the world of tuberculosis. And TB is a disease that many people here in Denmark and Europe think was eradicated last century or so. But it is rampant, and about 10 million people in the world are affected or infected by tuberculosis every year. And 1 person dies from TB every 20 seconds. So TB, just like TB, just like COVID, is spread by the air through particles. And like the same way, like as with COVID, TB is spreading even before you have signs and symptoms. So it's a lung disease, and thanks to that, we can actually identify changes on the lungs with the chest X-rays. And this is where I want to bring you back into some of the work that we're doing in South Africa. And apologies, I'm going to try one more time to do a screen thing, because I have some problems with seeing my notes on the side here, which is why give me a second. Okay. So while TB is a lung disease, in the olden days, so before AI, what would happen was that people would have to go to get an X-ray, and this happened in the times when my parents were young. And on the changes on an X-ray, and that is read by a radiographer, you can actually identify if you have changes in the lungs. Now, in a healthcare setting, such as in Africa, what used to happen was that you had to wait for a patient to be sick enough to experience the symptoms, get themselves to a clinic or a hospital, and there they would get an X-ray done, and the X-ray had to be read by a human. When we got digital X-rays, that was improved because at least we could now have the expert sitting in Europe or the US or another place centrally where they could actually read the X-ray. So what AI is doing now is that it is reading the X-rays for us and therefore able to identify people that have changes to the lungs, or presumptive TB, as we say. So we have been working with this technology since 2019 in mobile vans, and this is the mobile van in front of you. The mobile van is operated by 3 people, not 5, as you see there, which is a driver who's also a data capture, a data collector. We have an enrolled nurse and a radiographer who assists. And this is what it looks like inside of that van. So basically, we collaborate closely with the Department of Health and take out the mobile van into the communities, and then coordinated measures together with the clinics to invite all kinds of people in to visit, to be screened in the mobile van with X-ray. And this is important because over the past 18 months, we have been screening over 20,000 people. And when we invite all people, in a congregate setting, which might be in a farm environment or a church or other community gathering, or as I mentioned, in conjunction, with a clinic or other higher TB burden setting, it means that people who are being screened by the X-ray may or may not have symptoms of TB. But our results show this is what it looks like on the X-ray. and how the X-ray can be utilized to identify small changes visible to the eye and the lung. So in the about 20,000 chest X-rays we've shown, we identified that around 7% are actually suggestive of TB. But with ordinary bacteriological testing, we can only 2% of these people are actually identified bacteriologically and clinically as having TB, which means that with the X-ray we can find many more people. So if you think back to the COVID scenario where you get infected with COVID and you are actually sick and actually transmitting, but even before you actually have any symptoms, and during this time you're actually spreading the disease. TB is exactly the same, with the only difference that TB goes much slower. It's a very, very, very slow disease where it takes weeks or months before you actually start showing symptoms of disease, while during the same time you're actually transmitting it. So this technology, using AI to read the digital chest X-rays like this, you're actually able to find people before they have even gotten sick to show symptoms, which means that under ordinary circumstances, they wouldn't even have been sick enough to say, hey, maybe I need to go to a clinic or hospital. So by finding people early, we're able to, put them on treatment and stop that chain of transmission earlier. So this is really an enormous example of showing like how AI is actually able to revolutionize and make an enormous impact in diseases such as TB. Of course, this now opens up other questions for us, because our algorithms and our treatment methods, are not on par now with this new digital advancement. So if you have a person who on the chest X-ray or with AI is now indicative of having TB, but you don't have symptoms, we're in a difficult situation where we're wondering, well, then what should we do? Should we actually start them on long treatment? And in the case of TB, it's 6 months treatment. Should we start them on preventative treatment? Or what should we do? So while there's still very many questions ahead of us and things that we need to do still into the future based on this, this is still a very, very important point of how we're advancing health and healthcare. Another example is through stethoscopes, and this is some of our collaborators and colleagues in AI diagnostics who have developed a stethoscope that you can actually listen for TB. So where in the case with the chest X-ray, you actually have to take the chest X-ray, you take a snapshot in this microsecond that you take the snapshot. This is what the image will show, but in the stethoscope, you can actually listen, over a period of time. And with so much data and information that we can analyze now with AI, we can actually listen for TB. So we are hoping to collaborate with the AI diagnostics to expand this technology and learn much more, not just about the technology, but of course about TB. And the technology as an AI and a stethoscope can, of course, be utilized in many more settings other than TB. You can just imagine it can also be used for child and maternal care during pregnancy and in many other cases. So this is where I'm stopping to talk about AI and devices, because I'm sure that you can already think about many, many, many other ways or cases in which we can use AI and devices. The other is in synthesizing information. And what I mean here is if you think towards WHO policies and international treatment guidelines, each country having their own standard of care or set of procedures, drugs may or may not be available, in different countries. Children need to be treated differently from adults. If you have underlying conditions such as tuberculosis and HIV or diabetes or any other thing, your treatment may change and diagnostic procedures change. And of course, in addition, when new technology or revised and updated guidelines come, which happens all the time, it can be overwhelming amount of information. And not just that the information itself is overwhelming, even in talking about one disease such as tuberculosis. In many countries, and here I'm speaking specifically about South Africa, the healthcare system is set up so that nurses and healthcare staff rotate. So every 3 or 6 months, there's a new set of nurses in the TB department, so to speak, and then they will rotate away into maternal department or whatever else they go on. So, not just, do you need to then be updated, uploaded with all of these new guidelines for this new people that rotate through the department, at any given time. And of course, this affects and the quality of care that these patients receive. Are they going to be diagnosed properly? Are they going to receive the proper treatment, etc. So this is where AI comes in, and where I'm happy to say that we are setting out on a collaboration with a Danish organization, Sonobotics, where we are actually aiming to load all of this information and all of these guidelines into an AI nurse assistant. And that AI nurse assistant is going to be able to help the healthcare provider. And this is what we think that could look like. So we're setting off this in South Africa to begin with, as we need to still calibrate the AI and to setting it up in a training situation. But the ideal would be that this could be a nurse assistant that collaborates. It could be a doctor's assistant too. So don't quote me exactly on the words. But simply an assistant, that is available and working side by side with the healthcare provider, and that can then help and say, I have a patient in front of me, as a child, so they also have, diabetes, or they haven't, whatever it may be, and you can quickly, get the response. And of course, we can type, like we know we're typing with, ChatGPT and others, AI at the moment. But this is also now interactive verbally. And I'm really excited about this and think that this is really going to improve the quality of care and the consistency of care that we will be able to provide in these settings. And of course, this is not just for Africa, but for the world, where this would make a huge difference. So this example is then talking about AI assisting the healthcare provider. And the other example is about AI assisting the client directly. So the person who's seeking care. And again, there are a million different kinds of roles and areas that this can be used. And where one of the examples that some of our colleagues are working on is providing information to people on HIV preventative treatment. So this is HIV PrEP, if you know about that, where the AI can simply interact, through a simple interface that can be used on a phone, and where you can have a dialogue with the AI to find out if you're ready. Is PrEP really something for you? How does it work? What would the side effects be? Any kind of information that you would like to know. And where some of these, advantages are, in providing this information, is that it's information on demand, as in different, when we have brochures and things like that. And of course, the other is that a lot of these topics, are now, private, or, like difficult to talk to another real human. And maybe getting that information through AI is really helpful. So again, the bottom line about this second example is really, how AI is helping us synthesize, so pull together a lot of information and making it very easily searchable, and in an interactive way to the user. So whether that's the patient, or the healthcare provider themselves. The next example. Yes. So this is a curious thing that I wanted to share with you before I go to the next example. While we're talking about patients and Africa, and you may be aware of a lot of these conversations around biases and these large language models, not taking into account differences in gender or race or culture. And one of these funny things relates to language. And if you were to test today on ChatGPT, which you may or may not have, it can speak perfect English, Danish, Swedish. It can also speak perfect Zulu. But it speaks, and the problem is it speaks too perfect Zulu because people don't actually speak a perfect language, and I'm using the word and not really appropriate. What I mean is that in real life, people code switch. And this is particularly, we do it all the time, and particularly so in many of the African languages. Yebu, how's it? It's just an example of how we're trying to speak in South Africa, both isiZulu, and then mixing it with English. And if you were to provide or make an AI that is going to speak to whether it's a patient or the healthcare worker, it's specifically relevant to patients and specifically relevant, and if it's more sensitive matters that in the future we imagine that AI could be assisting with. What is the tone of voice? What is the language use? And most importantly, how do we train AI to speak like real people speak? And one of the suggestions that have come up is to maybe to have these large language models listen to radio, local radio stations, where people are talking all the time and code switching all the time. And maybe that is a way of teaching AI how to speak the way that real people speak. So jumping to the third example, which relates to data, and where the problem here is that we have so much data. And when we speak about the healthcare sector, right now, I'm not talking about the patient management data or information that a doctor or nurse has in front of them. But I'm also speaking about the program data that of any country, like how many people are sick, with tuberculosis in this country, province, district, hospital, clinic. How many are women? How many are men? How many are children? Are they getting cured? Are they not? What comorbidities or side of, other kinds of, treatments, diseases, may be co-affecting. So we have, we've in Africa specifically, it's been over the past, 1 or 2 decades that I have been working there. It's been, going and still is moving from paper records to digital records. But that has been going on and is really rampant. We have enormous amounts of data available. But are we using it? Or rather, are the people who actually need to use it using it? And are they using it when they need to use it? And this relates to people who may be hospital managers or people who may be program managers for TB program, HIV program, no matter what. They need to make decisions with regards to their resources. Where do they need more staff, less staff? Where do they need to provide training? Where should they launch a new mobile clinic? Where do they need to revamp a clinic? Where do they need more drugs or less drugs? So this is where AI comes in, and where we are working on a very exciting project, which is funded by the Gates Foundation under the Grand Challenges, which is titled Equitable Use of AI in Low and Middle Income Countries. So what we're doing there is that we are uploading routine program data to a large language models, in fact, to ChatGPT, but there are others now, where we can simply upload the data, the routine data. Of course, here I'm talking about de-identified data, so not, and there's no, patient confidential information. It's simply numbers, like I said earlier, numbers of people's attending clinic and so on. And where we're using AI to clean the data, to analyze the data, visualize the data, and most importantly, to translate all of this to some kind of insight. And that with these insights, with a program manager, for example, they can then, make an evidence-based decision on the matter that they have in front of them. And this is a really, I think, is completely revolutionizing, not just because it enables people to have access to data, not just once a year or at national level, but you can ask the questions, from the data set that relate to your clinic or to the last quarter. And also reminding ourselves that it's really closing a gap between the people who produce the data and, eat and sleep and breathe data all the time, data capturers, data managers, but they are often just producing tables, and they don't really know how or what or really the impact. And on the other hand, you have these people that are the hospital managers or program managers that are responsible for these decisions, but they may not be as astute in interpreting graphs and tables and bars. Like, they miss the so what. And so in the project that we have been working on in the past 6 months, we have shown that we can actually put in all this data, and we have validated that actually, like, the ChatGPT can count, it can do very advanced statistical analysis, and it can actually synthesize that into valuable insights. So kind of like this is, what this looks like. And this is just, very simplified in order to be able to show something. We can simply then upload the data into ChatGPT, ask it to clean the data provided, and show tuberculosis treatment success by HIV status in a bar graph. Very simple, but in our hands, we're using it to triangulate data sets. We have enormous data sets with, thousands of entries, and this is what it produces. We can then also go on from there to ask the ChatGPT to provide key insights and summaries of the analysis. And this is what the output, that ChatGPT is giving us. So based on all of the data that we put in, the ChatGPT is actually telling us, look, from this data we can see a high prevalence of HIV among TB patients. There is a significant treatment success is observed, great, but there's still favorable outcomes. And again, this is very simplified, but in real life, we can say, this is, we can get, things that are much more complicated, where we can say, provide the insight for the program manager based on the data provided, and where we really get insights with regards to, is the data clean? Is it reported properly? Oh, I see that there is a problem between linkage to care. There's, screening rates are recommendable. That I'm reading from the second point now. While the screening rate is commendable, it's essential to ensure that all symptomatic people undergo investigation and that the process is seamless. I'm allowing you to read it for a little second. So what this is doing is that it is translating the so what. And not just that it is translating, from the data, the so what with a, a bar, graph or whatever, things are going up, things are going down. There's a gap in your treatment cascade over here. Is a mixture, all this thinking that really just, needs to be done, that a human normally does, but that we're often restricted in that we don't have enough time, that we don't have enough insights. And that, like I said earlier, the people who actually need to have these insights are not sitting down and playing with the data, or having access to their own data at the time when they need it to be able to make those decisions. So that is, I think also an amazing way for how AI is able to help us change healthcare and make appropriate decisions with limited resources. So of course, this is going to, more than ever in any place, it's going to be revolutionizing the care of in resource limited settings. So, but of course, I mean, this should and could be used in any place in the world, any disease, any place outside of healthcare. It is just so big to be able to actually use the data that you have. So lastly, I'm going to tell you just a little bit about like how we as an organization are using ChatGPT internally as an organization. And this maybe will inspire some of you to think about how we can actually use it. Of course, in this example that I just shared, we also use ChatGPT to analyze and present our own data. And where we, working with, so we are the implementing partner for USAID, for example, in South Africa, where we are providing healthcare and health interventions in many different provinces in South Africa. And we get a lot of this data in, and we need to ourselves analyze and present it. So of course, we do this on a regular basis, even with our own internal data. We use ChatGPT to then compile the reports, so you can just imagine if you already have all of the data there, you can also then, not just provide the insight for a decision, but then, okay, cool, I am the program manager, of this or at this district, please write, like a report, for the last quarter based on this data. Other ways that we use it is in our hands. We have to provide quarterly reports to funders, and we have many different, the same program is done in many different districts. And writing reports takes a lot of time. And so instead of having people in all these different districts, writing their own mini quarterly report, doesn't take any shorter, it isn't any quicker just because it's smaller. We now just simply ask them to bullet points, like what were the changes and why in this district, in this quarter. And then we bring all those bullet points together centrally, and we upload it in ChatGPT and ask ChatGPT to clean it, or like to clean the bullet points, to change the bullet points into a text, to remove duplications, add, basically write an executive summary or report. So while you can see that this saves enormous amounts of time for everyone involved, because we used to have to then compile these individual district reports at a central level. And so with ChatGPT now, I think it's really important to say, while I'm talking about all of this, is that there's still a human in the driver's seat. There's still a human that is making the final call. And it's important to say that, like the final product that is, that comes out towards, no matter what we do, there's always a human, that has actually, looked at it, synthesized it, thought about it. ChatGPT provides, like, is the assistant that compiles it for us, and allows us not to start with a clean sheet. So other things is we use it for grant applications. And again, here, it's important to say it doesn't, it's on one hand, yes, it writes the grants for us, but no, it doesn't write the grants for us. And I don't know if you've tried this, yourselves yet, but this is the example. In my own case, writing grants normally would take, pretend 10 hours. In my pre-ChatGPT, I would spend 1 hour on the idea, like what is it that the grant application is about, 1 hour, and then 9 hours on writing English. Now with ChatGPT, I spend 9 hours on developing the idea and 1 hour on writing English. And that is why I think that in our hands, it is really improving the quality of our work. And this same way of working is what goes into the reports and to the data analysis. Likewise, we use it to develop business documents. There might be contracts and policies that we need to develop, where ChatGPT gives us like a template, a format where we, give it, feed it some initial information and it cleans it up and tidies it up. We're using it for human relations. You can easily put in something like, oh, I'm having this situation with a colleague or even family member. What should I do? And it will, provide you astonishing ideas for how to handle the situation. You can use it for simple, planning events and timelines and, schedules and, write synopsis, for presentations or whatever. You use it to respond to email and communications on social media. I think that most of us are familiar with that. And of course, generally use it as a creativity and sounding board. We also use it for fact checking and, have I really addressed all these points, in this funding request, for example. So I think that there are many, many, many more ways, of using ChatGPT in an organization, any work. And for us, what it has done is that it has given fun back into our own work. And I think this is important to reflect on that, I love seeing, grant applications come to life, for example, but it is arduous and hard work in writing and producing, all these documents that we need to do. But allowing me to spend 9 hours or 90% of the creativity and development and really deep thinking about an idea, no matter what it is, and then only 10% of, on the, making it look nice on a formatted and right chapters and the background information, really allows me to think that my work, even these kind of things, is fun again. And that, I think, overall really improves the quality of all of our work. So I want to leave you with this and say that in my thoughts, if you look back at the last 100 years, it has been about improving the quantity, through machines and industrial revolutions, and how can we make things, more and more and more in numbers. And now with AI, the revolution, that we're seeing is that it's improving the quality of our work. And in all of these examples that I have showed today, I hope that this is really, you share this with me. It's improving the quality of our work. And ironically, in the healthcare sector, I think that it's also allowing us to be more human. So thank you so much for this. And if anybody wants to collaborate with us or talk more about this, these are our contact details. And please reach out, because we're absolutely not doing this on our own. Thank you.
Okay, thank you very much, Kristina. Perhaps if you stop sharing, then I can see questions from the audience. This was a very interesting presentation, and definitely highlights all the potential positive things that AI solution can be used for. So I don't know if anyone in the audience who are perhaps more IT illiterate than I am have questions. In the meantime, I do have one question. So when you, for example, talk about the diagnostic solutions, one thing, can you control the data that comes in to these AI diagnostic solutions? Meaning, do you have the kind of quality control of the data that lies behind the conclusions that the AI solution may come up with? And also, do you have any sense of how the AI solution prioritize different types of data that maybe have kind of contesting consequences for the actual diagnosis? I'm thinking about the control of the system. How do you ensure that?
So if in my interpretation of how to control the data and giving a practical example, such as with AI and the chest X-ray, is a need to calibrate the data, because for example, in those chest X-rays, like you can find changes and identify changes on the chest X-ray, but of course the AI can spot changes much more minute than we can. And so where do you set the needle? Like what is presumptive TB? What is a change that we should react on? What is a change that has a significant impact on a person? For example, we spoke earlier about, like with AI, we can identify people who actually have TB earlier, before they get signs and symptoms. Is that relevant? I think yes, in this context, it's relevant because people are transmitting. But then how? It's about calibrating the amount of information. And likewise, when you're adding in other diseases and things that I understood from your question, like it's a lot of it is calibrating and deciding with all of this information and data that we now have, how are we going to respond? How are we going to respond to it?
Mm. So it's because I have a hard time understanding the difference between what you would say advanced data analysis in a regular context, and where does the learning in artificial, where does the learning come in, and how does that affect the control?
Yeah. Okay. So maybe let me say it like this. Artificial intelligence is not intelligence. And maybe that's a very bold statement, but I'm trying to demystify it. Artificial intelligence is really a way of enabling the synthesis of a lot of information. Even the large language models, when we look at the text, AI has learned to predict which word comes after the other. So of course, there's a lot of data processing that it needs to do in order to, decide, all these beautiful responses that we get to, decide what words come after the other, in a specific context. So it's in my world, AI is an advanced form of a calculator. Yeah, and of course it's much more advanced now, but it's still only a tool, and we are still in the driver's seat. And we need to learn to use it, as the tool that it is.
But let's say again, also just from a legal perspective, I'm just taking the role as the skepticism right now.
I like that.
Let's say that you're using an AI tool that assists a doctor or nurse in diagnostic, and then you have a wrong diagnosis that has consequences for that patient. Would you then, from a legal perspective, be able to blame the AI company, the solution, or the doctor?
Yeah. I think that there's a lot of work in this area for a lot of people to take forward, and I personally think that there should always be we shouldn't allow they're good and bad things, and we shouldn't allow ourselves to be sloppy to say that if we only rely on AI, and like I said earlier, allow AI's output to be the final word, then we are actually decreasing the quality of our work. So unless you have to use it as a tool to increase the quality of the work. So it's an additional piece of information that you, as the responsible doctor, or no matter what profession you are in, you are the ones that are making the decision, and this is one more piece of information that you can use.
Yeah.
So not rely on AI.
Yeah. Okay, Kristina, time is up for today's session, but thank you very much for sharing your insights. It's very interesting, and I actually share your view. There's a lot of possibilities for creating a better future with these tools. So thank you very much for that.